I'm going to make a short introduction to introduce you to the two people we have here today. To my left is Dr. Jay Butler, our Chief Medical Officer for the state of Alaska. Dr. Vern Jelly, who is the Chief of our section of laboratories for the Department of Health and Social Services. They will both be able to talk today and will both be available for one-on-ones afterward. Dr. Jelly can talk about lab testing of influenza, and Dr. Butler will talk about this case specifically. Thank you, everybody, for working so hard to brave the traffic to get here today. Move right on to Dr. Butler. Thank you.
Thanks, Dan. Thanks, everybody, for coming out. I realize it's Sunday morning. It's Mother's Day. We should have had a big piece of cheese for everybody when you got here, because you had to run the gauntlet through a maze to show up. We did want to go ahead and share some information with you today. I know you received the press release already, but I wanted to go over a little bit of this case. Yesterday, we received reports of a probable case of the 2009 H1N1 influenza A virus, also called swine flu, in a crew member on board a cruise ship that it was traveling through Alaska waters, or actually is traveling through Alaska waters now. The crew member became ill on May 2nd and was tested while the ship was in port in Washington State. This person was placed in isolation in her quarters, completed a course of antiviral medications, and is doing well. The crew member has not had fever for over 3 days now. This probable case of H1N1 influenza is not a surprise. It reinforces the observations that this virus causes illness similar to that caused by seasonal influenza, but is also transmissible like seasonal influenza, and is now being confirmed in 43 states, also in the District of Columbia, and in 28 other countries than the United States. I'd like to compliment the Royal Caribbean Cruises, which operates this ship. They've been working closely with health officials and have taken measures to prevent spread of illness. The staff, we're told that the staff have posted messages on board the ship encouraging people who are sick to report to medical staff and report their symptoms. Finally, people who've had close contact with crew members are being monitored regularly for any flu-like symptoms. At this time, we have no new reports of probable H1N1 influenza linked to this crew member or this cruise ship, or in fact, at this time, anywhere in Alaska. Specific information for preventing spread of infection of influenza on cruise ships and in Alaska ports of call is also available at our website, pandemicflu.alaska.gov. And at this point, why don't I stop, and we'll be happy to take questions you may have.
Dr. Butler, where's the vessel heading?
The ship, we're told, is currently in Icy Strait and will be docking in Sitka in the next couple of days. And more detailed information is also available. We have a contact at Royal Caribbean that you can feel free to contact. Okay.
And do you know when they will have the test results to confirm if it is H1N1?
Do you want to?
Yeah, I'll take.
Probably be in the next day or two, and I'll refer to Dr. Bernie.
Okay. Thanks, Jay. The specimen was originally tested at the Washington State Public Health Laboratory in Seattle, because that's where the patient became ill, and it did come up H1N1 positive in their lab, and they received a number of positives prior to that, but because this is a brand new test, and we are fast-tracking the FDA procedures and protocols for getting new diagnostics on, it's under an emergency use authorization protocol. So when a laboratory first isolates or gets positives for the quote-unquote swine flu, they have to send their first 5 positives to CDC for validation. And they've already sent 5 down to CDC, the Washington State lab, and they're just waiting for those 5 to be confirmed. So that's why we're still calling this a probable case. And I was talking to my colleague down in Washington State, Dr. Ramesh Galtoom, and they expect to have their confirmation by Monday. And so when their initial 5, this was not part of their initial 5, but when those 5 get confirmed, then they will be able to say, yes, their test is validated, and then they can confirm it as an actual H1N1 swine variant.
Thanks.
just on that, how many cases have there been in Washington State so far? Or is it-
Do you know?
I know it's over 100
Okay.
so far. You probably saw that they reported their first death yesterday also, which is the third national.
What will happen when the cruise ship arrives? I mean, how will it be treated?
It'll be treated just as it was, has been treated all along. The measures have been taken to prevent spread of influenza on ships. The thing that's different about this one is the crew member who's been diagnosed, or anyone else really, with influenza-like illness, whether it's on this ship or another one, will be confined to quarters to limit the possibility of spread. The cruise lines have already taken steps to make sure that hand hygiene is available, whether that's through hand washing or use of gels, like this one's not a commercial endorsement, but such as this one are available. And the idea is to try and keep people who are ill away from those who are well. Also, they're being very proactive to try and keep the crew members from working when they're ill, that they would be confined to their quarters if they are becoming ill.
Dr. Butler, this is probably a question for the cruise line, but have you heard any reports of other crew members or other people on this ship having symptoms, flu symptoms?
Not since this crew member was identified. There was one other crew member who developed influenza-like illness when the ship was in California, had a rapid influenza test that was positive for influenza A. That is not specific to the new strain of influenza. He was managed as if it is the new strain. He was isolated, received antiviral medications, and has recovered completely.